Dr. Adibfar completed his postgraduate plastic and reconstructive surgery residency at Vanderbilt University Hospital in Nashville and at the University of Toronto, and became a Fellow of the Royal College of Surgeons of Canada in plastic surgery in 2003. Dr. Adibfar enjoys private practice in addition to being a clinical instructor for the postgraduate aesthetic plastic surgery programs at the University of Toronto. He is a member of numerous provincial and national organizations in the fields of medicine, dentistry, oral and maxillofacial surgery, and plastic and reconstructive surgery. Please welcome Dr. Adibfar to the Botox stage. Come and join us. Please, come and join us.
Welcome to the New You Show.
Thank you for being here.
I think the Botox injection is going to be shorter than the.
I know you have the most impressive intro of any doctor we've had so far. I just could have gone on all day.
Good, great. So we have Kathleen here, and basically what I'm going to try to show to you here is we're going to treat some of Kathleen's concerns with Botox. When she approached us at the office, her main area of concern originally were the crow's feet, so she's going to go ahead and show you those. Can you squint for me? What people call the squint muscles in that area, and as a consequence you get wrinkles around your on the side of your eyes, and Botox is a great product to treat these wrinkles. Let me point out, can you try to smile? Now, some of these wrinkles that are further down here are not treated with Botox, and people get quite confused. When I ask them to squint, they actually smile. So I just want to remind you that the Botox only works on the muscles that causes the squinting, not the muscles that move the corner of your mouth up. The other area that we're going to go ahead and treat for Kathleen is her frown muscles, which gives her these two little ritids in that area. That's going to help relax this muscle and soften up some of these wrinkles, but it would also help elevate her eyebrows. The eyebrows are suspended in the air between two sets of muscle, a set of muscle that move them up and a set of muscle that move them down. So by weakening the ones that pull them down, that's going to help us elevate her muscles, specifically by weakening some of the muscle up here and over here. Now, can you move your eyebrows up? She also has some wrinkles in the forehead, so we are going to soften some of those as well. However, we have to be very cautious. As I mentioned just a few minutes ago, if you overdo these muscles, that's going to directly drop down your eyebrows, and therefore you have to be very careful of that. Can you give me a little bunny line there, please? Sometimes when you overdo the Botox in this region, people have to use other accessory muscles in order to frown or smile. And commonly people get little, what we call bunny lines in that area. So to prevent that from happening, we may use a couple of units of Botox in those muscles as well. Now, let's see you whistle for me or try to purse your lips. She has a few wrinkles around her lips here. Now, some of these cannot be completely treated with Botox, but by putting Botox around the muscles of the lip here, it's going to help soften those up a little bit. We cannot overdo this because this may cause some crookedness of the lip and difficulty sucking through a straw or whistling, and therefore you have to be cautious when you work in this region.
And a life without whistling would be a very sad life.
Definitely.
It really would.
Most definitely. Now, the other area that we're going to concentrate on is, with time, there are two muscles that pull the corner of the mouth down. Now, the corner of the mouth is very similar to the eyebrow. It's suspended in the air by some muscles that pull it up and some muscles that pull it down. So, if we weaken the muscles that pull it down, can you roll your lip like that? These two specific muscles, relax. Then therefore, that's what that's going to do. It's going to help these other muscles gradually pull it up and therefore be a more smiling looking lip. Now, she has a few dimples in this area. Botox is a great product for little dimples in this area. She doesn't have as many as my next patient, so perhaps you will notice it more in the next patient, and we'll depict that to you. If we have time at the end, we may go ahead and put some Botox in some of the muscles of the neck here. Can you tighten up your neck for me? Like this. More specifically, this muscle here and that muscle there. And therefore, that's going to smoothen some of the transverse wrinkles of the neck.
Dr. Adibfar, may I just ask, because obviously Kathleen is a little shiny, so what is it that you put on her skin?
Oh, just for the stage, I've put on about half an hour ago a product called Photocaine, which is a topical anesthetic, similar to Embla, but much stronger. And I think that it really helps for any type of injectables, and more specifically Botox patient. It just takes away some of the stink. Having said that, they're still going to get some stinging, okay? Very rarely people can get a minor bruising on the side here. It's not that common, maybe 1 or 2 patients in 100, but it can happen.
We've heard a lot of that actually today. Now, would the drooping be from just an injection near the eye, or could it be from any area that's been injected? That's something I've been wondering about.
Yes, I was specifically talking about bruising on the side of the eyes, but
sorry,
you brought up the
issue
of drooping.
Drooping is one of the possible.
It's important we mention to the patient that by doing Botox of the glabellar region, the frown muscle, there's a very, 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 very slight chance of getting a droopy eyelid. A droopy eyelid. Not an eyebrow, but an eyelid. I got to be honest with you, it's never happened to me, and I do this all the time. However, if it does happen, it's not the end of the world. There's an eye drop that we can prescribe for you, which will counteract the effect of the droopy eyelid until the Botox wears off.
So it's only a temporary side effect.
Speaking of wearing off, the Botox usually lasts anything between 3 to 6 months on any given patient, so they will need renewal of the Botox injection. You do not see the effect of it right away. It usually takes anything between 3 to 7 days for you to see the action of the muscle.
Please come and join us, ladies. I see you're fascinated.
Come on over, so we're going to go ahead and start
relaxing
working on Kathleen.
Seat at the Botox stage. We'd love to have you.
Usual. Turn it this way. Yeah.
How are you doing, Kathleen?
So great. Yeah. So what we're going to do first, there's a muscle here that actually is part of the frown muscle, but also gives you these little transverse wrinkles on the base of your nose. We're going to work on that first. So why don't you put your head back? Great. And can you do this for me, Kathleen? Perfect. So what we're going to get is just a little pinch there, and that's it. Perfect. And you put pressure there while I'm doing this.
Do you want her to prop up a bit more for camera? Should we prop? Okay, can we just, Doctor, is it possible if we just prop her up a bit with the pillows?
Sure.
Just to make sure we can get ideal for the camera, for the monitor. Just want to make sure you're comfortable, Kathleen.
Oh, there's the monitor. Okay, I thought it was one of those kitchen cooking monitors.
How's that? Is that a little better? Perfect.
Perfect. So now we're going to use about 13 units on the muscle of the frowning muscle on this side, and frown for me. Good. And you can see how this muscle essentially is from all the way from the midline all the way to here. So you have to get the whole thing. Otherwise, sometimes you get a residual a vertical line in that area, and people complain about that. So relax for me. Okay. And frown for me. Relax. Now, sometimes I try to find a little pore in that area. Sorry. This is 5 units there.
5 units, okay.
Okay, and then...
Sorry, you just said you try to find a pore in the area? Is that to
if
the
they do
side
have a pore, it's really helpful. You do not feel this thing as much.
Oh, interesting.
You're doing great. And 5 and 5, and another 3 unit at the very edge. Can you frown for me, please? So I'll find the very edge right there, and now relax for me. Perfect. That's it. Good. Now we're going to do the opposite side.
Are you feeling anything at all?
Slight sting.
Slight sting. That's what we've generally heard from most people, a slight stinging sensation.
Now I've customized this dosage to Kathleen's needs. I usually like people to have some mobility still in their face, otherwise they would look like a mask face. You can always add more Botox, but you can't remove it. Frown for me?
That's an important thing to remember.
Relax.
I think that's good for people to hear when they're considering it.
Little pinch. And frown. Relax. Frown. Relax.
If anyone in the audience has a question, please just let me know. And if you ask a question...
You can see the edge of the muscle here.
Oh, Laurie's there with some prizes. If you have a question, Laurie will take your question.
Relax. Good. Now turn to the left. Good. Okay, hold on to that.
Do you have a question, ma'am?
Yes, this woman has a question.
Sure.
Dr. Adibfar, the question is, how long does the Botox last?
As I said, it really depends from patient to patient and on the muscle itself. If the muscle is stronger, it does not last as long. So in general, it lasts anything between 3 to 6 months, usually between 3 to 5 months. But let's say on the same patient, just think of it as a headache. You know, sometimes you only need 1 Tylenol for a headache. Sometimes you may need 3, sometimes a lot more than that. Same thing with Botox. If it's very cloudy outside, if you're frowning a lot, if during your sleep you're frowning or crying a lot, therefore you're attempting to use that muscle more, and therefore the Botox can wear off sooner. So it really varies, but in general, it's anything between 3 to 5 months.
Great question. Now, we should keep rolling here because we have a second patient to see during your time. So
move the eyebrows up. So we're going to do the forehead muscle here just to relax some of those. As you can see, she's got some over here. So we're going to do a series of 1 units. 1 over here. 1 over there. 1 over here.
We've been told many times today that the needle is actually, it's an insulin needle. So it's a very, very, very tiny needle. So it's... and I'm not sure if you heard that Dr. Adibfar said that if he finds a pore in the skin, it's actually less painful to insert through an actual existing pore in the skin. I'm learning new stuff with every physician. It's quite fascinating. How many of you are here at the New You Show for the first time? Just curious. Anyone here for the first time? Oh, we have a question from Lori. Yes.
Perfect. So this is, and I'm on the lighter, I always do it on the lighter side than other doctors on the forehead because, as I said, you can always add more. That's fine, no problem.
We have a question from the audience. Is that okay with you? Here we go.
For Adibfar, the lady here would like to know about how much does it cost?
The cost really varies from doctor to doctor. I guess if you did a survey around the GTA area, it can range anything from, I guess, $10 a unit all the way up to $17 a unit. So it really depends on who's doing it and what area they're working at. But I think that's the price range. And you get charged by unit. And she is going to have, if we do her neck, a total of probably 120 units. But on average, people have anything between 30 to 90 units.
And something we've also been hearing about a lot is that when you have male patients, they actually require more units because they have stronger muscles. Is that correct?
Think of it as a stronger bicep. So male patients may need much more than that.
So the men have to fork out more dough than the women.
Move your eyebrows up. So I'm going to try to, by putting some over here, it's going to give a little lift on the lateral brow, on the side of the brow. And relax for me now. This is the area where you have to be very careful, and it stings a little bit. And I try to prevent. Sometimes these little syringes get stuck, so don't worry.
Just keep smiling, Kathleen. It's all right. No pressure. Sorry. You are on camera. I just want Kathleen's jacket.
You have the other one.
Isn't it fantastic?
Okay, let's try this one. The other thing is these are insulin needles, and what happens sometimes in the factory, some of them are a little duller than the other ones, and therefore, did you see how much better this one worked? So maybe we'll just do the right side. Just kidding. Okay. All right, squint for me. Squint and relax.
You'll just be very expressive on one side, Kathleen.
Yeah, exactly. So here we're going to put a series of 3 units. And again, here I actually injected intradermal, not into the muscle, because the dermis or the skin is so thin that by doing it this way, it stings a little bit more, but it minimizes the chances of injuring any tiny little blood vessels, and therefore minimizes the chance of getting any bruising. And you can see I come all the way down to this muscle, to this wrinkle here. And this last one always stings the most. Okay, you did great. Okay, let's try the other side.
Dr. Adibfar, this seems like a very creative process. I know it's also obviously very scientific.
This is for this and that, yeah. So this is what we're going to do, the bunny lines that I mentioned to you, just 1 unit on each side. Can you try to...
1 per bunny.
Good. Just like that TELUS commercial. All right. There's no carrots here. All right, good. Little pinch here. All right, and turn over here. Perfect, you're doing great. Now relax.
Kathleen actually looks very relaxed. Sort of like when you get your hair done.
The topical definitely does help. I don't always put it on. I have to be honest with you. I did it today just for being on stage. So I want it to be a little bit more comfortable. Let me go on the other side.
We're going to do the switcheroo?
Yes. Yeah? Wish me good luck now with this time. This side. Don't worry, we'll take care of it. Now, move your eyebrows up for me. No, good. Relax. We're going to try to get a little bit of a brow lift on this side.
Just wanted to remind our audience that Dr.
Adibfar
will be next door at the Cosmetic Consultation Center. If you have any questions for him, if you've been considering any of these procedures, it's a wonderful opportunity to speak with him in person. Most of the physicians that we have on the stage today and tomorrow will be next door at the Cosmetic Consultation Center, which is an amazing opportunity for you, especially if you've never had a procedure before or if you're just thinking about it. So please take advantage of that.
By stretching out the skin, it minimizes the pinching a little bit, and it also helps me at least try to see any blood vessels that are there so I can prevent them. Good, perfect. I think it was meant to be used on this side. Yeah.
It's a left side thing.
Yeah, there you go. Okay, let's go back to the other side. Upper left.
How you doing, Kathleen?
So we're pretty much moving down to around the mouth, and now we're going to use this for the pursing, for these tiny little, what I call these smokers' wrinkles. And incidentally, Botox combined with Restylane Fine Line is a great treatment for these little wrinkles. Okay, let's do that. Purse your lips for me. So you can see we're going to put one unit here, one there, and one over there. Now, if you can see, her left side is slightly stronger than the right side. But what I'm going to do as a first time on her, I'm going to use the same equal symmetric amount, and then later on I can always add some more. And there we go, 3 units for that.
Now, is this also Botox, doctor, or is this
yes,
the rest?
This is Botox.
This is still
I'm
Botox
not using
because
any
it's the muscle.
Okay. So, and then for the lower one, she's got much fewer wrinkles. And can you purse for me? And just basically 1 unit there and 1 unit there. Purse for me. You can almost see a little bit of a hyperactivity right there. Okay, relax. 1 unit there, and purse your lips for me. And basically 1 unit right there. Perfect. All right. Now, 2 last. There's a central chin. So we're going to do these dimple lines. Kathleen, can you show them your dimple lines there on the chin? You can see these little dimples. Botox works very well for that. So we're just going to do it again. Okay, 5 units right there. This is a muscle that lifts up your lip and therefore causes this dimpling in that area. When people cry, that's when you see the dimples. Okay, and lastly, we are going to do the muscle that pulls the corner of the mouth down. It's called the DAO, and definitely that's going to give you a lip lift. So can you do this for me? And it's attached specifically in an area here on the bone, and right there. That's one.
Dr. Adibfar, if you don't mind answering this, when it's a first-time patient, is there generally a procedure that most people request for their first time having Botox? Is there a really popular area for women?
Yes, the most popular area for women, the ones I'm mentioning down here are not as popular, but the most popular area is the frown area and the crow's feet and perhaps the forehead. But with time, we've gotten more and more comfortable doing the lower area of the face as well as the neck. Okay, can you roll your...
We're going to have a male patient for the second procedure, so it'll be interesting to talk about male patients doing these procedures.
I think for the sake... How much more time do we have?
We have another 20 minutes. So
I think for the sake of time, we're going to... Well, let me just do the neck as well. It takes just a few minutes.
Let's do the neck.
She's here, because everybody wants to see it. Now, let's see. These are called platysmal banding. Yeah, like this. Good, perfect. And now turn to the left, and you can see this band. And try to flex it again. And put your chin down a little bit, and do this. Look at me. We have a little hard time showing them to you, but let me come on the other side, perhaps it's easier for everybody to see it. So commonly, you can put anything between 20 and 40 units in the neck muscle here. Do it again. Perfect, right there. Did you see that? Incidentally, there's a big vein over here. You have to be careful and not hit that vein. Yeah, so you have to be careful with your anatomy.
This is why you want to make sure you're with an experienced person.
And the muscle is really attached, just go ahead, do it again, just underneath the skin. Do it again. Perfect. One more time. Yeah, I know, it's hard work. Believe me, in 3 days you won't be able to do this.
A reminder for anyone in the audience, if you have any questions, please let Lori know and you will win a prize. She's right over here with the microphone.
One more? Okay,
here's your chance.
That's one side. So I just put 10 units on each side.
10 units per side.
Yeah,
How
so
you doing,
20, but you
Kathleen?
can go as high as 40. I mean, you can even go higher. All right, perfect. Can you see that here, down here? Mm-hmm. All right. Oh, this earring. All right, good. Do it again, but put your chin down. Good, perfect. Do that again. All right. I know she's got a hard time. Good. So we'll just, let's say it's over here. I kind of know that it's there anyways.
It's such a tiny needle. It's quite
when
amazing.
You do, incidentally, when plastic surgeons, when we do neck lift, this is the muscle that we actually tighten.
Hold on, I want to break.
There we go. We're done. Perfect. You did perfect.
She's all done. She did
Clap
very
for her.
well. Let's give
Okay,
Kathleen
there
a
you go.
hand. She did very well.
That was her exercise. Good. Well, we're all done. So we did the Botox for the rejuvenation of the forehead, a little bit of a brow lift for the frowning area, little bunny lines, the crow's feet, the wrinkles around the mouth, to lift up the corner of the lips, as well as remove some of the dimpling of the chin, and then some of the neck transverse wrinkles of the neck. Thank you very much.
Thank you so much,
Okay.
Dr. Adibfar. Thank you,
Thank you.
Kathleen. And we
Perfect.
have